much for inviting me to your this gathering and to share views regarding the socio-economic consequences of this massive problem that this country and the world is passing through. Uh, I shall, of course, agree with most of the points that Professor Shorkar has made. So essentially, I have no comments on those issues. So let me try to focus on certain specific problems, which I think uh, involves medium to long-term revival of the Indian economy and certain basic structural transformation that we are likely to see for the Indian economy. And in a way, it's quite uncertain how we are going to tackle those problems. First, I'm going to talk about a very concrete, down-to-earth health issue, which is, quite worrisome at this stage. You see, what has happened, if you look at the broad data of COVID-19 infections, active cases and death rates, etc., across states and of course for the country as a whole, you will see that now, particularly in the last 7 days, and also we kind of apprehending that for the whole month of June or in July, this there will be increasingly rising cases of infections in this country, and that we can see that every day there is a record because it's a convex curve with the second order conditions is also positive as we are moving with more infections. See, the problem is not in the death rate. Some people are talking about death rates as low in India and so on. What I'm worried about, and I think many people are worrying about this, is that our health infrastructure, for example, to give you a very concrete example, number of seats in hospitals, public hospitals, private hospitals, you take together, they are not capable of handling a huge number of infections if a very small percentage of infections comes to the hospital for treatment. Because what is happening is that increasingly, the hospitals are being filled up. In fact, I have information that in big metropolis, effective costs of getting a hospital bed is increasing through the roof. It is also important to realize that beside COVID-19, we have many more complex diseases or regular diseases that affect, the citizens. And nowadays, if you want to get a treatment of those diseases, those are not getting the right kind of priority because the health infrastructure in this country actually is remarkably inadequate compared to the size of the population. So it is very important, and you can understand that only when I think individually you are exposed to that problem. So it is really critical that how the governments, state governments, central government, and so on, how they are arranging for rapid increase in the infrastructure in hospitals or hospital-like arrangements for all states and particularly for the metropolitan places where the rate of infection is much higher compared to many other places. So it is, more I see as number of people going back home, uh, after getting rid of this infection, but more I'm worried about the fact that if the standard percentage of this COVID increasingly infected people do not get proper hospital facilities, not only the death rates will increase, but you see you can easily see that the weakest point or the weakest part or the weakest segment of our fight against the COVID will be health infrastructure. So I think this is a very important point, and I hope that the governments are looking at it. Yes, they are trying to expand facilities, but God help us, because if the infection rate goes up with this rate, then it is not possible to contain everybody at home with sort of uh, help in health matters, and they have to be taken to hospitals. So that is a big problem that I foresee, and I think that this is we should be aware of. The second issue, because these issues that I'm talking about would be kind of scattered, because I'm not going to sort of take one sort of line of argument and develop that. The second issue, again, I think, which is very important, is the way that the states are going to finance their deficits. Because, like the central government, the states do not have access to certain kind of financing of public expenditure. For example, states cannot go to the RBI and borrow directly from the RBI. So that states cannot take share of the newly printed money. States cannot monetize their fiscal deficit. States cannot lay hands on a lot of resources that the central government can. And this is going to be big problem for the state, because till now it is almost like the states are begging resources from the center. Now, this should not have happened after 70 years or 75 years of independence. That there have to be certain instruments in the hands of the state government, so that they can actually exercise their choice during this kind of national or state level disaster. In fact, certain number of finance ministers have posed this question to the central government. The point that I'm trying to make is that, first, it is not very transparent how this new financial package of 20 lakh crores, if it is there, how it is financed by different sources of financing, as it has been pointed out by Professor Sarkar. We do not know how much the government is willing to take loan, because some of these help in terms of financial resources are in terms of credit, and if you don't take the credit effectively, the government doesn't have to make any provision. So the financial provision of the states, of the central government, should be very transparent for mending the fiscal deficit, which, compared to the last announcement of the budget, from 3.8 to 4%, it must have gone above 10%. In fact, very conservative estimate of nominal fiscal deficit to be 11 to 12%. So the question is, where from these resources will come? And if these resources can come easily to the government of India, when the states face remarkable shrinkage in their available resources to combat COVID, because in many ways states also do not run on surplus resources. The question, therefore, given the fact that the states cannot print money, how one should expect that the states should raise resources? Now, one possibility that has been talked about is that, of course, states' borrowing capacity has been increased, from, I think, 3% to 5% of GDP. But as the finance minister of Kerala has mentioned rightly, that in the time of crisis, if you want to issue a fresh bond, who is going to pick it up? They can only pick it up if the interest rate is very, very high. And that's the problem of raising finance at the time, in bad time, that you cannot go to the market and do it. So basically, the government has to think of ways so that it can get, if it has to borrow extra, the state governments need certain kind of uh, uh, best practice alternatives that can actually help them. So the financial, the position of the state government should be properly evaluated, and their fiscal deficit, how that can be monetized through direct borrowing from RBI and things like that, that has to be discussed at the national level. So I am not seeing that these type of issues are being talked about in public domain, which I don't think is right. Uh, the other thing that I'm going to talk about is actually how the economy, or how the Indian economy will look like when, suppose, we have a vaccine, and suppose that we go into the next year, because I cannot improve the estimate what has been given by World Bank or IMF or ADB, that on both financial years, the one which is in progress and the next financial year, fiscal year, our growth rate is bound to be negative. So it is meaningless to talk about positive growth rate so on. Next 2 years you have to be happy with zero growth rate, and you have to be happy with the fact that if the GDP does not fall below a certain level. Already the GDP has crashed to a very large extent, and we are hoping that with this some respite from the lockdown, there will be some kickback in the rate of growth. But that is really not the concern now, because there are more important issues. But one must, as economists, sort of contemplate or imagine how there will be structural economic transformation in this country. Now, it is very important to realize that in India, people are essentially are not law abiding. That's why the lockdown process, and when the lockdown process is kind of lifted to some extent, you can easily see the experiences from social media, from print media, television, and so on, that people just don't care to be protective about themselves, and they don't care that not being protective about themselves, they are going to ruin the health of others in the system. So it is beyond, of course, not imagination. Given the fact whatever the government asks us to do, we are not used to doing that. We try to find out ways and means not to do that. But that's what we should keep in mind, because eventually the workplaces, production organization, whatever you think now, including rearrangements in restaurants, to how the shop floor will actually work, you will see that companies are going to enforce social distancing to some extent. And if they do it, that would completely change the way we organize production. One consequence of that is going for technologies which do not require many human beings. In fact, I always try to cite this example, that now in a full-fledged, you know, big scale cement factory, you do not employ even more than 5 people. I was amazed to sort of know this from one of my friends, that such has become the process of automation. And this was before COVID-19 affected India. So now what you are going to expect is that there would be a lot of interest and encouragement towards technologies which do not require people. You know, the activities where people have to stay together and work, these activities will be affected to a very large extent. In fact, there is different evidence in different parts of the world that where the population density of economic activities are high, those economic activities are worst hit by the COVID-19, and they therefore would have the worst time in terms of recovery. So, these days people are talking about, restaurants, business, and so on, by saying maintaining social distancing and this and that, etc. But mind you, India survives on the strength of big consumer market at various levels of expenditure. And that is one of the lifeline of the Indian economy. We cannot deny the fact that the crowded spots in markets, crowded spots in during lunch hours, in office places, and so on, and typically, in traditional industries, crowded spots are very common in production organization. And how that is going to be affected after corona, or during corona as we go into the lockdown, we don't know. In fact, this would be a very critical thing for measuring the extent of the recovery that the Indian economy can expect. And that's what I am becoming very, very pessimistic. In fact, my point is that until and unless you have a solid vaccine, and very, very sort of effective vaccine available at to all, and one can access it easily, there would be certain consequences of this natural disaster caused recession, that cannot be solved overnight. Because you can easily see, one example would be the macroeconomic example, that people nowadays in India is an excessively consumer oriented economy. In India, the saving rate to GDP aggregate is 31%. For China is 46%. Just compare these two. Now, I'm not saying that an aggregate measure will give you how what is our own propensity to save, because that might depends on different levels of income. But the fact is that once people are scared, like they would remain scared in general till the vaccine is coming up, as long as that is possible, that is there, they are going to increase their savings, and therefore, the multiplier effect is not going to work that much. So the whole question is that if we had a lot of savings, maybe we could have tackled the our loss of income well. But government of India never provides us with household level savings data, and it is it is talked about as if 50% of Indian population are living in debt. So the fact is, if there is a disaster, this kind of natural disaster comes, everybody just waves their hands and say that we don't have stocks to deplete, to replenish. So I mean to get help from. So the idea is that a strong vaccine, a very effective vaccine, accessible vaccine is needed for sort of least cost transformation of the economy. But at this stage, I am really scared and skeptic about the problems we are going to face in next 6 months. It's not a problem of that the lockdown is not being lifted and the work activities will not come up. It's a problem of transportation. It is problem of how production is organized. It is problem of essentially the health, and hygiene requirements in workplaces and so on. So I do not know how we are going to tackle this. These would be interesting areas of investigation, and I believe.
Sir, you are muted. No, it's okay. It's okay.
Okay, yeah. So as long as people think about it and people try to investigate the consequence of this kind of shocks, the consequence of this kind of transformation to this unnatural economic and social shock, I think it will be interesting food for thought for the economists. And I believe that we have to live with hope, but the uncertainty, the extent of uncertainty is so much that we can only contemplate and just sort of throw stones in the dark. But we have to at least know which target we are actually throwing the stones at. So that is what I think is important. And thank you very much.